Hello and welcome back, everybody. For those of you guys who didn't check out our first introductory video, which I would encourage you to, again, my name is Riley. I'm a doctor of physical therapy as well as a geriatric certified specialist for 𝑖PAL physical therapy. On the first video, I used a few terms as far as successful aging versus unsuccessful aging, and so I wanted to go a little bit more in depth with that on what those two meant, because that was based off the examples that we talked about our highly functioning elderly and aging patient versus our highly under-functioning patients within or clients within the same age group. Successful aging is a process of aging without the loss of disability or the process of disease, and also keeping a highly functional, mental, and physical component within the lifestyle. Unsuccessful aging is actually the complete opposite. We see loss of function, we start seeing debility, we start seeing frailty among those people, and really just a loss of functional independence. We actually see people lose the capacity of everyday daily activity for about 50 to 60% of their normal daily routine. And what that means is, as far as that's the loss of endurance or tolerance related to that because of poor heart and lung function. What I'd like to do is give you guys some information on some things that you can do at home and utilize to help with our heart and lung function, and that is actually called a floor bike or an ergometer. You can generally find these online in your big box stores. They're relatively cheap, they're compact, they're versatile, and you can use them both for your legs and your arms. And what it is basically what you see in the picture as far as is a small stationary bike that we can utilize to get some people involved. Basically to work out the heart, the lungs, and even if you have arthritic joints, it's also very beneficial for that. As we tend to age, the recommended value for cardiac or endurance related activity tends to be about 150 minutes per week, which basically breaks down to 30 minutes per day, 5 times a week. Now, I know in some cases 30 minutes seems to be quite the time span and may seem very long duration to some people. However, we can actually make that a little easier and utilize our stationary bike for maybe 3 10-minute sessions a day, and maybe progress to 2 15-minute sessions today, and then progress to where we are tolerating 1 30-minute session per day. So it's an easy solution, it's something to get people involved, it's something to get you encouraged. As I mentioned in the first video, if you guys have any questions or anything, I really do encourage this to be an interactive forum. Please comment on the video below or even email me with questions that you may have or suggestions. Also, in the meantime, we ask that you stay healthy, stay safe, and stay in the pursuit of wellness.